Well, I think it's estimated that this medication non-adherence issue is costing about 125,000 lives per year in the U.S.
Just in the U.S.?
Yeah.
Wow. That's a good amount.
Yeah. Yeah. It's not a trivial matter.
No, that's actually good to know. So don't skip your days. Welcome back to the AI in Healthcare podcast. I'm Noah Vandal.
Joseph Yoon.
And today I'm going to be acting as host, and we're having Dr. Yoon talking about AI aging specifically. Yep. I'm sorry, which is a very critical component. And you and I, we've talked about this dozens and dozens of times, hours and hours. So getting right into it, I guess, not even talking about AI. My first question for you is, why is medication adherence such an important issue and something to keep in mind?
Yeah, I was looking back on my career and medical history in recent years. Past 50 years, the American healthcare, and for that matter, healthcare in general, has gone through multiple transformations.
Okay. Like
and
what?
In terms, everything. So as the science advances, our modality of different treatment have changed. The diagnostics have changed.
Sure.
Radiology, we have MRI. We use it all the time. Ultrasound has gotten better. But past 30 years, I would say the number of medications that we use have gone up by a lot.
Really?
Yeah. So that is one change that I definitely noticed. When I was in medical school, for instance, there weren't that many medications to use for, say, acute MI or post-MI care.
Sure.
But now we have so many different medications that people take. And we live longer, but with multiple chronic diseases, especially seniors. And how do we treat chronic diseases with different medications?
So that makes sense. But at the same time, like you take one every day and you just miss one. Like, how bad can that be?
It depends on the medication. So some medications, yes, you can skip it, and it really doesn't make much difference if you just skip one. But for something like a blood thinner, it could be pretty significant.
Really?
Yeah. And also, if the medication's half-life is short.
Oh, you want to stay on top of it.
Right. So
do you think that people maybe do even have reduced life if they don't take it, like, religiously on the set schedule that they should?
Well, I think it's estimated that this medication non-adherence issue is costing about 125,000 lives per year in the U.S.
Just in the U.S.?
Yeah.
Wow. That's a good amount.
Yeah. Yeah. It's not a trivial matter.
No, that's actually good to know. So don't skip your days. So yeah, I guess like more holistically, is taking a step back in America. What does it look like? What does the current picture look like for medication use, and especially with an aging population? Yeah, so
this medication adherence issue is particularly an issue with seniors, since they are the one who's living with multiple chronic diseases and take multiple medications, and thus this issue of taking medication is a big issue. I would say about 1/3 of patients. In my experience, have some issues with taking medication as is prescribed. Yeah, wow. So it's, and I confess that sometimes I am prescribed with antibiotics, for instance. Often I did not finish it when I felt better.
Well, it went away, right? You felt good.
Yeah, so guilty as charged. For a variety of reasons, we don't adhere to the regimen as it's prescribed. But in seniors, I think it's more prevalent because there are many different challenges, including cognitive issues, and number of medications are as it goes higher,
Right.
it's more difficult. And so we see that being a bigger problem for seniors.
Interesting. Okay. So I have some more questions, but more about on the AI topic. Before I get into that, then, what's our quick takeaway in terms of medications from a physician?
So I think for medications, there are several strategies that one could employ to increase some medical adherence.
Okay.
One of them is some sort of a reminder system, or it could be a medication cabinet or boxes. So I think that's very helpful when you can check that there are medications still in the box that you were supposed to take.
Oh, yep.
Versus not.
Sure.
Because sometimes people forget. Oh, did I take my medication this morning or not?
Right.
So that's one strategy. And also, in my experience, when people understand why they are taking medications, for instance.
Oh.
So medication education.
Interesting.
I find that those patients take medications a lot more in adherent manner.
More than just saying, oh, just because,
Right. Our doctor just told me to take it versus...
Probably to make more money,
that versus, okay, I know I'm taking this because I have a blood clotting problem. I know I'm taking this because of, say, my cholesterol problems.
Sure.
When I understand why I'm taking it, and I think people tend to adhere to the regimen better.
That makes sense. I guess then that leads into, I can kind of already foresee a few cases, but how would you use AI then to help out those processes?
Yeah, so AI has tremendous potential, in my opinion, for improving medication adherence, especially seniors, because AI has a capability to talk to patients.
Okay.
In a scheduled manner.
I see. I'm probably at their level too.
Yeah.
Their understanding.
But also, what's different about AI is that it has the level of knowledge to share with patients.
Smarter than you?
Yep, smarter than many physicians, I would say. I think there was a recent study that showed emergency room triage diagnosis was better with AI.
Really?
Yeah.
Even, is this just like a super advanced model? Or is this just like the regular ChatGPT I use?
I'm not sure about what model that they use.
Okay.
But, when I speak to different AI agents, be it Grok or ChatGPT, all of them have a very sophisticated, high-level medical knowledge.
Really?
Yeah.
Even the free ones, the public ones.
Right, and they could converse with you on that.
Sure.
And AI is very good at speaking at your level. And so I see tremendous opportunity using AI to improve medication adherence.
That's actually really cool. And I suppose too, then, you could probably ask, okay, why am I doing this, and get a more concise answer.
Right.
Okay.
And the AI can give you a reminding message.
Sure.
They can call you.
Oh, yeah.
I think we developed a voice AI agent that can call patients by phone.
Sure. Right. Yeah, which is a great reminder.
Yeah. So those things are tools that clinicians and family members and patients can use.
Interesting. But can it do my laundry while I'm in bed?
Well, we need robotics for that.
Robotics, maybe in the future.
Yes.
Anything else we should know about taking reminders and that type of AI and aging?
I think I see tremendous opportunity when we combine AI with something else.
Oh, sure.
So, for instance, just AI, is a text form in the beginning, but now we added a voice.
Yep.
What if we combine that with wearable technology, for instance, or and how with the robotics. So let's say we can imagine that the medication dispensing machine that is already in existence.
Oh, really?
And if one can combine that with the AI brain, then that could be a lot more sophisticated.
Interesting. I did hear about like a recent company, and they're starting out like a preliminary trial. I think they're in Utah for AI auto prescribed refills.
Yes.
So
Yeah,
again,
I
like
think
still
that,
doctor in the loop, very much so, but
yeah.
very cool because then it's one less thing for the doctor to do.
Yep. Yeah. So the refill is the one of the physician's job that takes a lot of time, and yet it's there are sort of not too complicated questions to go through and so on. So I think with physician supervision, and as long as a physician agrees with the protocol, I think AI would be a great agent that can go through different questions with the patients at the point of refill.
Okay. Yep. Wow, that's cool.
Yeah.
Well, thanks for your time and thanks for answering the questions. And it's exciting times we live in.
Yes.
Bye.